Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy in Walden University. And today in this video, what I wanted to go over is the quest for trying to determine definitive diagnosis, and then a lot of times when you have chronic diseases, how difficult it is because of the fact that there are phases in the interim where there are times of remission. So it's oftentimes difficult to deal with, grapple with, and if you've ever had a chronic condition, and one that is more difficult to treat, then this is something that can be problematic. As I was going through the literature, I'm actually going through a neurological workup and EEG, and I thought that this would be of benefit for those of you that might be thinking about neurology or conducting neurological research. There's a lot that has been written on brain rhythm and brain waves. And they've found this 10 hertz frequency in my brain, and I got curious. And there's actually a cognitive load that your brain is able to handle, beyond which there's this fulcrum. And there's this transitional brain state. And so there's all these different types of rhythms, the mu rhythm, the alpha rhythm, and I'm going to actually show you a nice figure right here. And this is figure two, looking at the sleep-wake frequency fulcrum, so to speak. So when you're sleeping, the EEGs, they electroencephalogram, and this was something that was put in my head. Actually, I still have the sticky glue from the test. Basically, there's photic stimulation, lights that's provided, and so in the sleep, you see theta and delta, and that's how the waves look. And then the electrical waves in the wake full cycle, you look at beta and gamma. This is what it should look. And this is the mu rhythm, and then this is the 10 hertz rhythm, which is actually different than the mu rhythm, the beta rhythm, and the gamma rhythm. And so this is why it's called the transitional state. The EMG, when you have electromyograms, you can kind of diagnose Huntington's chorea, Parkinson's disease tremor, and any sort of physiological tremors. Now, tremors, I'm not going into too much detail with tremors because that is actually a whole different way. And if you study neurology, then you learn to identify. I was trained in identifying different types of tremors as when you look at in neurology. So here are the physiological recordings, and here you can see the intrinsic membrane oscillation. And so this goes into just all the different types of neurons, and the percentages of different types and electrophysiological tests of these channels. Anyway, so in a nutshell, there's so much that is not known in neurology. I've presented on Alzheimer's, Parkinson's, some original research, but even looking at epilepsy and seizures and neurological disorders, these things, there's a lot more, and medications research needs to be done. They need to be updated. A lot more advocacy is needed because many times it's difficult to connect in terms of patient affect and understanding the different perspective that your patient is going through. So on an individual clinical level, this is an important issue to be looking at, but on a population level, to public health folks, I'm telling you, neurology and seizures, epilepsy, these types of subjects need much more directed research to better understand and diagnose early on and be able to treat seizures before they become intractable. And that is the whole purpose of prevention and prevention of chronic diseases. Thank you for listening.